I'm very glad to be part of this session where the title is World CML Day, presenting new strategy and sharing best practice. As you all know, World CML Day was initiated by the CML patient community in 2008. And September 22 was chosen because of its symbolic significance. On this day, patients across the world come together to raise awareness about their disease and needs. World CML Day is not only an annual awareness and a global celebration, but also an action day to raise awareness about patient needs, to give information, treatment updates, to educate and communicate with patients, and also to show and to present the activities and projects to media and partners. World CML Day is also a good opportunity to collect data, to build partnerships, and to recruit volunteers. Before I jump into AML experience specifically, I invite you all to check the World CML Day Toolkit training on the website of CML Advocate Network. AML Association has a national office in Marrakesh, a second one in Fez City, and a third one in Casablanca, Settat City, led and chaired by our friend Amal Himrim, here present. Now, let me share with you Amal World CML Day experience in Morocco. 2011 and 2012, we organized a big CML awareness campaign in the famous Jam El Fna Square in Marrakesh. 2013, we brought Jam El Fna Square to Mohammed VI Hospital in Marrakesh. 2014, we climbed with physicians, nurses, volunteers, patients, and family the highest mountain in Morocco, Toubkal, with more than 4,000 meters, of course, with a media awareness week. 2015, we organized the first CML patient summit in Casablanca. 2016, we hosted a CML conference in Mohammed VI Hospital. 2017, we organized a press conference to raise awareness about patient needs, treatment, and testing access. And 2018, we organized a common event with Power of CML Egypt. As you can see, we try to diversify our activities as we can. World CML Day 2018. Ahmed Awad from Egypt and I, we decided and we suggested to organize the same event on World CML Day in both countries last year. And we have decided to work with Egypt because Morocco and Egypt are on the same continent and have the same language, culture, challenges, and needs. And our challenge was the distance and lack of resources. We couldn't reach other patient group. So we used internet and the webcast in our favor to be closer to patients and for them to ask physicians closely. The purpose was purely educational and aimed to inform, educate, and enlighten CML patients and their family about the disease and its management. The event, done by AML Association Morocco and Power of CML Egypt, was sponsored by Novartis. Thank you, Novartis, for this. We were live for 65 minutes with 3 speakers, 2 from Morocco and 1 from Egypt. And Ahmed and I were moderator. We had a panel discussion with frequent questions asked by patients to CML experts from Morocco and Egypt. And of course, we collected all these questions from our WhatsApp group and face-to-face patient meeting. We have chosen Facebook because it's the most effective social media when promoting events. We start our Facebook campaign on September 15, based on the Facebook communication plan, as you can see on the picture. And the event was created on Powers of CML Egypt and the AML Facebook page with the agenda, peak time and place, event address, and also contacts. We agreed on using the same hashtag, اليوم معا ضد اللوكيميا المزمنة. It's mean today together against CML. And we agreed on this hashtag for all communication, program, poster on Facebook. And this hashtag was tracked to evaluate the campaign impact and the results, of course. And we published also an educational video about TFR and disease management. Now the results and impact. We had 300 attendees, and we used the benefits of broadcasting. We saved money and time. And the event page reached 7.8K. And the video, we had the number of views, 4.3K. We had 22 comments, 19 shares, and 38 reactions. And of course, the video was an excellent tool for patients with a huge rate of literacy. And this event allowed us to build a relationship with patients, and most importantly, we reached the maximum of the patients of both countries at once. And it's always good to tell a story, because telling a story will help you to promote this event. And when it's come from a patient, people are more willing to listen and interact. Thank you very much.
Thank you, Bahija. So do we have questions from the floor? Yes, please.
I want to ask, so the Facebook session you had that was live, so when people logged on, was it interactive, or they just typed in the questions? I'm asking this because part of the things we experience in our region is people are embarrassed to come out publicly and say what the issues they have are. So I'm wondering, assuming I wanted to do something similar, and I had a Facebook, I don't see a lot of people wanting to engage with me interactively by showing their face. So how did you do yours?
I think in our region, when a patient speaks, you give the opportunity to others to speak also. I am patient like you, and we encourage patients to speak also. But the first thing, you should prepare your session. You should prepare your patient for this, because you will be in live. And then we prepare everything, the question, because we collect all questions. The patient kept asking in the WhatsApp group and face-to-face, and phone and everything. And this question, we choose only 5 from Morocco, 5 from Egypt, and then we prepare a panel session with 2 physicians from Morocco and 1 physician from Egypt, and then the patient asks, and then the CML expert answers. And we use also question card. We collect all this question, and maybe you as the moderator, for example, Ahmed and I were moderator, and then we ask this. The most important thing is to ask. Even if you or another one or by paper, you can ask. I know that is an issue in our region. Yes?
Hola. Bahija, I want to know how many followers do you have in your fan page?
Fan page? For
Facebook.
Facebook. Mine or?
Institutional. Huh?
Organization, you mean?
Of AML.
5,000.
5,000.
5,000,
okay, thank you.
Yes. My Facebook, I stopped people because I reached more than 5,000 now. Maybe it's become a page.
Of course, Ken.
May I ask you a question about the live video event? You will receive more than 4,000 views, but only maybe less than 20 comments or share. Do you understand why?
This is the culture. I think this is the culture of people from my region. They see, but they didn't give comments. This is something cultural.
Oh.
Because if I comment, people, they will know that I have CML, I have cancer. And they see, but no comment, no maybe sometimes no sharing, nothing.
Got it.
Any other question? Bahija, I have a short
Yes.
comment.
Okay.
This is actually a fine example of using social media to forward our advocacy story. Thank you for the positive insights from the results. But what would complete the picture if you could tell us in your preparations, if it's an intra-country, within the country, Facebook Live,
I'm sorry, what?
if it's just within one country, it's simpler, it's much easier to do. But you did it with Egypt. So what was the learning curve there? Were there any challenges? Because it's a live broadcast. What you say on air, you cannot take back. So
I think it's a lot of preparation with Ahmed and I. We prepare everything about location, about speakers, about Arabic, because we don't use the same Arabic. Then we try to use the classic Arabic to be sure that everyone from Egypt and Morocco can understand everything. I think it's maybe you can make only one country, but we challenged us to make two countries, and this is a good opportunity to show Egypt, for example, Moroccan patients show Egyptian patient that we are the same, that it's the same story. You can talk, you can share, you can, you can talk about your disease, no matter you from Egypt or from Morocco. We have the same story.